you're in a sticky situation, or you're in a situation where you're troubled and you feel like the walls are closing down on you and the roads are, all your pathway are blocked and the doors are closed, and you think that it's the worst thing that can happen to someone, look at your left and your right, your neighbor. Your neighbor always has it worse than you. How do you present to the doctor, 18 years old, and you run for 5 miles every day, and then suddenly you finally walk a block, you're short of breath, and this happened to me, And this young lady came in and she says, "Doc, I can't even walk a block." When I checked her out, she's 18 years old. She had breast cancer, metastatic disease to the lung. 3 months she was gone. That's the problem. She didn't even reach, adulthood, actually, in real sense. So you look at your neighbor, the guy without a leg, and the guy with diabetes who, that weird amputation capital of the world? Yes, we are. People are losing their legs like crazy. That is why I'm telling you, man, you stay away from a lot of the animal product and red meat and all those things, and stay close to plant foods. It decreases your incidence of diabetes. Very terrible disease. And did you know that if you drink coffee, at least 2 to 4 cups a day, decreases your incidence of diabetes by 7%? News for you. And guys, I'm bringing facts. It's not what I think. We go with the data. Okay, now this is your program today, 434-1771. 434-1790. 434-1791. You can call us anything on your mind. This is your program today. I didn't come with an agenda. So I'm going to free flow with you. Ad hoc, actually, or anyway you want to call it. But we'll talk about all these things. In the meantime, let me tell you what Benji. I like a lot of dogs. As a matter of fact, I like the Rottweilers, and I had 9 at one time. I was into this stuff. Benji, but anyway, Dr. Welch had a nice dog that I mated with my female, Eve. Eve was kind of big, As soon as I get a call, I'll take it. Yes, so Eve was kind of big, and so we had these 9 pups, and guys, I did a little bit of surgery. I took the tails off myself. Normally you got to take. I said to myself, I do a lot of cutting. I could cut a tail off. Then I did some local anesthesia, and before you know, the tails were gone, and I put some nice antibiotics there, and then I had these beautiful puppies, man, and I watched them grow. One of them excelled. He was 6 inches or half of a foot higher than the rest, and the paws were like you looking at a tiger or one of those panther or one of those guys. When he walks with strength and power. So I took a liking to the fellow, and I would turn my corner. That's at least 100 yards away, and he hears that engine, and he comes out and stay just by the gate, looking in and looking for me. And if any one of the other siblings come, he would just give them a little roar, and they would have to stay back. So he knew that he was top dog, and the master loved him, But so one day, they were all agitated over an animal that came in around the fence, and they were running back and forth. And I came down, and do you know what happened? They were panting, so the animal went away, and then they were panting and just agitated. But Benji was panting much more, severely. He seemed to be short of breath. But I said, he probably was more agitated. I didn't know what was happening until the next day. My nephew came and said, Uncle, Benji's dead. I says, no way. Came down there, he was there. Benji was having a heart attack. Didn't know. I for the heart attack. Humans, not in there. My little dog. So, dogs are man's best friend, actually. Then when I look back in retrospect, I thought about it. He had growth hormone problems. That's why he was so big, and people with growth hormone problems normally are prone to heart attacks. So I probably could have given a little bit of aspirin, a little bit of nitroglycerine, all those things you give for people with heart attack, and I would have had a nice Benji today. But, have you ever seen a dog with a stroke? Or a cow or a sheep with a stroke? We get stroke and stuff. Anyway, things to think about. We got somebody on the line? Good morning.
Hi, good morning. Dr.
Yes, speak a little louder for me, please. Thank you.
I have a question. What's the normal heart rate for a female, say around 45? I'm asking this because whenever I take my pressure, my heart rate is always in the 90s. It has gone as high as 106. But then when I take my husband's, his is always in the 60s and the 70s.
Well, that's a very good morning to you. A very easy question. It's always good to know normal, you'll know what abnormal is. And I like your question. I always teach my students and my young doctors, I always tell them, you have to know what normal is. So when you see the abnormal, you will know. It's like a woman who is growing up. She should be able to do some breast exams every month. I'm not getting away from you, but I'm coming to you. Yeah, every month. So she can know what normal is. So when a lump appears, she will know what abnormal is. So heart rate normally, for the young kids, when the neonates and the infants and so forth, they have a higher heart rate because their heart very small, got to push a smaller amount of blood. So if you move up, if you increase the speed, you get enough blood to the brain and so forth. And as you get older, your heart rate comes down. For an adult age 18 and over, your heart rate should be between 60 and 100. If it's over 100 and you're not agitated, in other words, you weren't running or you're not excited or somebody didn't give you something or bad and so forth, your heart rate should be between those. If it's below 60 and you're not taking any medicines, except you're an athletic person who runs a lot, your heart rate shouldn't be less than 60. So those are the ranges. So if you're up at 105 or 6, it's not very very much out of the range, agitated or so forth. When it goes to 120 and 125 and 130 and resting state, then you got a problem.
Okay.
But what I could do, I advise you right now, if you find that your heart rate is constantly high on the higher range, there's something called thyroid, a gland you have just on the thyroid, and thyroid has to make sure you're not hyper as opposed to hypo.
Okay.
Ma'am, thanks.
Thank you very much.
Yes, so we'll be playing songs at the festival. We got another caller? Yes, this is the People's Program, so I'm going to take all the calls today. Good morning.
Good morning to you, Doc.
Yeah, good morning.
Yeah, I just listened to you talk out.
Yeah.
And you were a heart man.
I am.
And
yeah.
then you should have known that the bigger the puppy was, the more exercise it would need.
Yes, I agree with you.
And normally puppies that grow like that always have a conformation problem.
You know, it's true. I think he was too close to me.
Because what happens, sometimes they grow too big, and then the legs can't accommodate the weight.
Yeah, it's true too.
And then you have a conformation problem. But you wouldn't see it while it's young. But as soon as it gets older, then you see, he has some bad conformation problem. The legs, battle or things.
What do you think happened? What do you think happened to Benji? What do you think?
I think he lacked exercise because he was growing too fast for the age.
You think so?
Yeah. So that would be the problem.
You don't think it could have been that thing I mentioned, the growth hormone problem with the bones being so big?
No, not really. Because you see, the thing is, he's eating well, and he's growing faster than the body can really take it, and he's not getting the exercise because a lot of people think that a dog running up and down the yard is exercise. But the thing is, if you walk a dog, you will see the difference of how it pants and how it reacts to when it's running. It runs by itself. When it's there, it walks. But if you walk it for a certain period of time, then you see the difference in the exercise.
Oh, so in retrospect, you're telling me I should have walked him like every day?
Right. You should have walked him. Okay. And then that would have built the muscle on the legs, and he would have been more muscle than fat. So what you call, because I remember I bought a race back one time, and he had some terrible back leg problems because he grew too fast. And people used to ask me if the legs were broken.
Okay.
I said no, but I used to walk it so that it would stretch, when it would push back the back leg and strengthen the leg muscle. And then eventually it came out. So when you get these pups that look so big and healthy, people always go for the fat ones. I like the runt. Because the runt is always the stronger fella because, he's fighting for his life. Right? So the thing is, you didn't walk him.
Gotcha, man. You see, why didn't I talk to you about a couple of years ago? You know, I would have had Benji right now.
Yeah, you see. So I was just listening and saying, here's the vet who looks at me, here's the dog who looking after the heart, and telling people to exercise. And he would not walk, Benji, you know.
But, all right, no. Let me stop you there. I walked him, but I didn't walk him, you know. Because, I walked him. He was the one that I walked.
Right.
And he used to pull me, man, and just bruise up my knee and all that type of stuff. The guy was so strong.
But what you should have done then is, if anything, you had a garage, take him away from the others and run him around the garage. Burn off some of the energy. See, because that pulling is that energy, is exciting.
You see that? You learn every day, brother. I really appreciate that, man. Thank you. I will incorporate that which you said. Next time I start my dogs, I'm going to do the same thing.
Because I keep them. I have Akita and Bull Mastiff. Right? See, but I have an Akita pup right now. It's about a year. And when I let it go, it's like a horse on the garrison.
You're kidding.
You see, it pulls and thing, but after it ran off that, it walks very comfortable. So that means...
Let me ask you a question, though. What do you think about those dogs? You think they get the same diseases that humans get, like heart attacks and stroke and stuff?
I had an Akita recently that I had to put away. You know why? It was my pet dog, but it used to have seizures.
Used to have what?
Seizures.
Oh, I got you. You're kidding me.
Seizures, yeah.
Seizures, epileptic?
Yeah.
Oh, man, you didn't try to give him some of those tablets?
I give him everything, but sometimes it started to get even more complicated, you know. Sometimes it was having it too regular, too fast. And then I asked the vet, and the vet said, you know, it would have to live on these tablets, and like sometimes if I'm not home. So I had 2 tablets that I had to give it because he was saying it's a lack of oxygen to the brain.
Oh, I see what you mean. Man.
So you see, the same thing that people have, it is not like putting a spoon in his mouth. It's like you got to get up every morning. You have to give him 3 times a day. And then sometimes, you know, he still has this seizure and he kick, you know, and then he's out of it. But then he's too docile, you know. He's like so relaxed, you know, because the tablets got him like drowsy.
Oh, man. So, must be painful for you. Did you cry when you got put away? Or?
You listen. Every night it used to break up my night rest, you know, trying to see if he died, and if he's dying, if he's having a seizure, and then I have to run out in the yard, and you know I have to soak him and then walk him a little bit. You know, it was painful. So I said no, I can't let him go through this.
Yeah, I'm sorry about your loss, and I thank you for all that information you give me, brother. God bless you. You take care of those dogs
take care
for
of
me.
yourself. Yeah. Okay. Bye.
Yes, guys, let's just come in with a song there for Rupi. There. We got another caller? Yes, their programs. So
Good morning.
Morning, how are you?
I'm okay. What about you?
I'm not bad. I'm just here this morning, sitting down, giving you guys a program. I wanna answer your questions. So you free consultation. Talk to the doc. How can I be this morning?
Can the thyroid glands cause a person to urinate fast at night?
Not really. What a thyroid gland does, it is responsible for how fast the cells work. In other words, if it overacts, it will cause the cells to speed up, and things like your heart, your perspiration, and stuff would be affected. Your breathing, all those things speed up because the cells, which is the unit, everything starts from a cell. So all the cells and the tissues and the organs of the body will work faster. If it's functioning at a low level, what will happen is that you would be sluggish, sleepy, and have even heart problems too. But everything will slow down, even your heart will slow down. But urination, no, it's not really associated with that. A lot of times if you find you're urinating more than you should, go get some blood tests for your diabetes, for sugar. That's one of the most common things. That's one of the most common things that normally you would cause you to urinate a lot. Or you may be taking some tablets that cause you to urinate a lot. Look for the word Lasix or furosemide and things like hydrochlorothiazide. You may be taking some pressure pills, and a lot of them, Naturalix and those things, cause you to urinate more than usual. So those are some of the things that I would think first. Go get some blood tests to make sure that your sugar is not high.
Okay,
thank you, ma'am.
Okay, bye.
So, we have somebody, should we give a call? Let's play one of Rupi. Rupi's my boy, you know. I love his songs. What you got, thanks?